We finally figured out how to beat them at their own game. This Med Advantage plan are not playing by Medicare's rules.
Ask me which one I hate the most.
Which one do you hate the most?
Can I say it?
Go ahead. Hey, good day, and welcome to the Offsite Team podcast. There is nothing more infuriating, usually, than working with Med Advantage plans when things don't go the right way. You name it, you can jump into that hole, either not being contracted, them changing the rules on you, the wrong reimbursements, and there's another 10. I'm sure I'm going to come up with those tonight right before I go to bed, because literally Med Advantage plans usually drive me absolutely crazy. But hey, how are you today, April?
I'm feeling good. How are you?
Not bad. Hey, before you jumped into the DME industry, have you ever even heard of Med Advantage plans?
Of course.
You did. Now tell me, what was your before the DME industry? How do you know about Med Advantage plans?
We've learned about MedAdvantage plan during the training. So when I was starting, we were trained about the insurance, all different type of insurance per state, different states, and that's where I've learned about it. And then now we're more dealing with them, which is why I have some ideas like on how to work things with them. So,
and what's fascinating is I'm convinced this is nothing more than a conspiracy theory. So if you want to throw this out, go ahead and do it. But we obviously have lots and lots of offsite team members, outsourced employees, and a lot of our employees have previously worked on the other side. They were hired by the Blue Crosses, the Med Advantage plans. So they were the ones, our current employees were the ones denying the claims on the other side. Hey, have you guys ever talked about that?
Yes.
And now tell me, well, they don't know. What did they say? Were they just told to just deny claims, or what would they say? What were they supposed to do?
Right. Mostly it's verbatim. So everything is in there. Like when a DME company submitted claims and something is not in there, like on their cheat sheet, then automatically it will be denied.
Deny. It's like that lady in the stamp, So they were essentially told, do whatever you can to deny the claims. Yeah,
I believe so.
Yeah, we know it. We know, because I know who we've talked to. We have our employees. They used to be on the other side. So here's what's cool. The offsite team members who used to be working for those other companies, they know what it's like on the other side. And because they were the ones denying our claims. It's so infuriating. It's crazy. So today, we're going to talk about working with Med Advantage plans. We have a really simple 3-step way so your respiratory, your rehab, your DME company can win working with Med Advantage plans, not against them. I mean, sometimes it's against them, but really we actually do want to work with them. And what's hard is they will say, oh, we're just following the rules. Well, it benefits the Med Advantage company to deny claims. We all know that. And I don't think anyone will ever say it, but I swear sometimes they're going to deny the claim in hopes that that patient either moves to the next Med Advantage plan, or that the patient passes away, or the patient goes on hospice, so they don't have to pay out on that claim. And it's just wrong. It is flat out wrong, because what we've had are senior citizens who have paid into the system. They deserve their claims to be paid. And that's not happening. But good news, we know how to work with it, don't we?
Yes.
Okay, so today we're going to give you a really simple 3-step method to working with Med Advantage plans so your store can win. So for example, this is going to be off. I'm going to start so easy. Step number 1, you need to know every single Med Advantage plan that your company is contracted with. And you're like, well, that's a low starting point. And not so much. The number of companies that I have talked to that, if you are somewhat large, don't know every single plan that's out there. And there are a lot of plans that you might be contracted with one Med Advantage plan, but not another. So there's a lot of different plans out there. So what's the easiest way of figuring out what plans a company is contracted with?
We can either call them or check the portal, check and see if we are contracted with them, call them. And then, well, it's supposed to be the company to provide the information whether or not we're contracted, which in our case, it is documented in Brightree for insurance if we are contracted or not.
And our customers, they have it easy because, for example,
Mm-hmm.
what's happening is faxes are coming across your, I'm just going to use the name John Smith. So like John
Mm-hmm.
Smith comes across a prescription for a walker or a wheelchair or a group 3 wheelchair, you name it, you're pulling them up and you're verifying insurance, everything
Correct.
from deductible, and are we contracted or not. Now, there are some spidey secrets that there are to combat this. So don't give the answer out, but if we have a Med Advantage plan that we are not contracted with, does that mean we have to just say no to it? Does that mean we give up and hand it over to our competitor?
No.
No, you're right. And you know this because there are some spidey secrets. Just because you're
Mm-hmm.
not contracted does not mean the answer's no. And this is,
Exactly.
and our staff knows just because a no is not a no. And who's really good at this are my kids. Hey, Dad, can I have this? No. Are you sure, Dad? And why do they keep asking me? Well, because they sometimes know the second, third, fourth, fifth time, I'm going to say, fine, have it. Have that second hour or fortnight, or have that second, piece of cake. There is an advantage to asking.
Mm-hmm.
And our staff knows this. And this is where this drives me nuts. But our offsite team, I'm like, okay, go after them. And you guys will go after them hard to get whatever widget is covered. Now, sometimes it's not worth that. If you tell me, you're coming in, you're not contracted with whatever Med Advantage plan, and you just need a cane, we're not going to go after. There are a lot that it's really worthwhile to go after. And so, number one, know every single Med Advantage plan that you are contracted with. There's pros to being in network as well as out of network. And even if you're out of network, there's a negotiation on what the out of network copay might be. And that can be negotiated as well. And you guys know how to negotiate it because we want our patients to have a 0% copay, 10%, 20%. Some of them, certain Med Advantage plans will say you have a 50% copay because it's out of network. That's just flat out wrong. They're just trying to not pay as much. And so step number one, know what Med Advantage plans your company is contracted with. Now, sometimes you actually do want to get contracted with them when possible. And we have parameters when to do that. But there are other Med Advantage plans we have chosen not to contractually contract with because it actually benefits us and it actually benefits our customers. It really depends on what city you're located, what portion of the country, and we can definitely help the companies that we work with. Now, step number two, once you know who you're contracted with, step number two is the reimbursement rates per plan. So give me a ballpark. What are the kind of, let's use a standard wheelchair. What are the rate options for how much Med Advantage plans are going to cover?
For a standard wheelchair, I believe it's around, if we're talking rental, it's $200 per month.
That's great. I have no idea which code you're talking about, but that would be nice. I think you're wrong, by the way.
Which wheelchair are we? Is it the K1?
I was looking at like 100% of Medicare allowables. What I was
okay.
100. I was like, wow, K1, that'd be great. No, but where I'm going is it's kind of we didn't do our pre-show note.
Correct.
But what I'm saying is typically Med Advantage plans will do what I commonly say is we're going to pay at 80% of Medicare allowable, or we're going to pay at 90%, or a full Medicare allowable. That's kind of what you typically will look at. So if a standard wheelchair, I'm just going to come up with $100 a month for the sake of easy math.
Right.
If they're going to pay at $100 a month for a Medicare patient, then the Med Advantage plan is going to pay 80% of that. Now, what's a little bit difficult is, so that would be $80 for a $100 wheelchair, but that doesn't mean you get $80. If you're out of network and they're only going to pay 50% of 80%, that means that first month check is only going to be $40. So that's difficult because you're like, I'm only getting 40. And then you have to go after the customer for the other $40 to get the full 80%. And we know this per plan and what that looks like, but we have to know the reimbursement rates per plan. This is also what's so not good about what's coming down the pipe. We talked about this in previous episodes. They have not fixed the Medicare rates for this year. So for example, we know the Medicare rates have already gone down anywhere between 20 to 35% on specific categories for 2024. Med Advantage plans are going to be dropping those rates probably starting July 1st this year. So we have to be aware of, let's say that wheelchair that we used to get $100 for is now down to 80 as an example. Well, if the Med Advantage plan pays 80% of that, now it's 80% of $80, not 80% of $100. So what we're going to see is this huge tsunami of decreased reimbursements. coming down the pipeline in the future months, and it will get fixed. Don't like, oh, Eric, it's never going to get fixed. It's going to get fixed. But what's probably going to happen, like a big storm, is DMEs are going to get nailed for the next 12 months until some really bad things happen. But that's just kind of what it was. A storm hits, and this is what's going to happen. But we have to know the reimbursement rates per plan. And what our store has already done, we've already had team meetings on it. This is what we're going to do to combat this, because you cannot be taking losses on DME equipment. Actually, you can't even take a little itty bitty profits. We need a set amount of profit per item to, keep going forward. And if not, we might have to drop some of the insurances that we currently are contracted with. So tell me, like, as you look at different companies and reimbursement rate plans, what do you recommend other companies do besides just know how much you're reimbursed by item?
I would say that they have to have an extensive training and check the HME news for updates, because you'll never know. Like with this plan, they might be covering this amount of percentage, 80%, but then after a month, they can also make changes on that one.
Absolutely.
So you have to be on top of your game.
Yeah. And just know, hey, this is covered here. This is covered here. This is covered here. And this is all the more reason to have an offsite team helping you guys out, is you guys are always staying up to bat with what's covered and what's not covered. And, we have not only offsite team members running our communications team, but they work alongside our billing team. So as certain denials come across, a certain reimbursement rates kind of go up and down, you guys are talking back and forth and say, hey, how can we work to provide the highest quality home medical equipment that really benefits our customers? So step number 2, know the reimbursement rates per plan. Now, step number 3 is how to win with each plan. Every plan is different. Now, they would say they're all the same. They truly will say, hey, we're all the same. Not true. Absolutely not true. Let me talk best case scenario. There is a MedAdvantage plan that we've figured out. We do complex rehab. We have 3 ATPs at our location. And literally, all that you need for a Group 3 wheelchair to be covered is a letter from the ATP saying, John Smith needs a Group 3 chair because of ABC. Now, what's in that letter has to be completely the same as what's in the LCD for Medicare. But we have gone up and we've said, are you sure? Are you sure? Then we just need to have that signed off by their primary care physician, and the wheelchair is covered. And it's one of those things we kind of stumbled into. Now, the rates on this plan aren't as hard, but it's really, really great. It's a huge service to our customers that we know this. So typically when we get some of these plans coming in, and I can guarantee you this is a MedAdvantage plan that's across the entire United States. If you're curious and you have an offsite team member with us, we'll tell you who this is and how to make it work. But we have done so many Group 3 chairs because we know, I don't want to call it a loophole. It's how they interpret the rules in the plan. And it works really, really well. Now, there are also, on the flip side, different MedAdvantage plans where that's like the best case scenario. There are other MedAdvantage plans that will say, nope, we have a K1 wheelchair. So according to Medicare's rules in their LCD, what they'll say is you just need to have a doctor's prescription and chart notes that justify that piece of DME equipment. These MedAdvantage plans are saying, nope, not only do you need that, you also need a physical therapy evaluation. And then they're throwing on like 3 other things that are above and beyond. Now, we've read the LCD and we're like, no, this is not what it says. There's a way to get around that as well, too. The MedAdvantage companies are not going to tell you. Granted, we know how to do it. And this is one of those things we had to appeal and appeal and appeal. And we finally figured out how to beat them at their own game. And this is one of those things we've actually taken this. We're in the state of Washington. We've taken this issue specifically up to the Washington State Attorney General's office, because we're saying this MedAdvantage plan are not playing by Medicare's rules. So there's 2 things. If you do run into that with a MedAdvantage plan, I'm going to say you have to appeal it up to your state's Attorney General, but at the same time, you have to play the game over here. So what we're doing is, we're working with our Attorney General's office, but then we've also figured out we can still get this covered until they figure out how to change their policies on the back end. And a couple groups like AA Home Care, they have some some really good advocates on their side, and they're working on our benefit. But in the meantime, just because it hasn't been fixed yet does not mean we give up and take our football and go home. We're still going to fight for the benefit of our patients. Now, so we have certain Med Advantage plans over here. It's really easy to work with. Other ones over here, it's really hard to work with. So it's really hard to win, or not hard. You have to know there's different rules for every single Med Advantage plan. So I asked you this I think it was last year on one of our podcasts. What's your favorite Med Advantage plan to work with and why?
United Healthcare.
I hate it that you say that. I'm not a fan, but go ahead. Tell me why you like United Healthcare so much.
Because it's easy to deal with them. Like, it's black and white, just like with Medicare. But ask me which one I hate the most.
Which one do you hate the most?
Can I say it?
Go ahead.
Community health plan.
Community health plan. I'm not going to say there's a version of which one, but why do you dislike it so much?
Well, you've given them all the documents that you need. We have the LCDs that we're looking at in front of our eyes. We have this, we have that. And then they will deny the prior authorization. And then they're going to ask for another thing. So I don't know if it's like someone is really reviewing, but then there's also another prior authorization that you will be sending over to them. But it will be
the prior authorization of the prior authorization of the prior authorization. But by the time you appeal and go through all of them and everything was there, guess what? The patient's now passed away. It's absolutely crazy. They used to be really, really good. So I couldn't tell you why it is what it is. So step 3, know how to win with each plan. Every plan is different. And there comes a point where you just like, okay, I don't know how we're going to do this. Actually, I will come back to community health plan. We have figured out how to win with those claims, at least on the rehab side, because it was one of those things were piling up. And this is actually one of those plans that they were denying claims, just very simple K1 wheelchair claims for a physical therapy evaluation, not required according to the LCD. So you need to know what is required per plan. And if you don't have the time for it, hire us. We will do the legwork for you, and we will put all of our education together and figure out how can we do this to take care of the patient. Now, a couple bonus points. You can work with certain Med Advantage plans, even if you don't have a contract in certain areas. So we kind of alluded this at first. You can do that, especially rehab. It's much, much easier on the harder items. It's a little bit it's easier to jump plans or get exceptions to the rules on unique items like group 3 chairs, even wheelchairs. It's a little bit harder if you say, hey, I need a CPAP mask, because there are so many companies, even if there's not a company in your area, they will drop ship it directly to the customer. So that's one of those things. Bonus points, you can definitely contract with different insurances, even if you're not contracted, if you know the secrets and run around. Now, number 2, one thing you could also do is to pit Med Advantage plans against each other. And there's a certain way to do this. Our team has learned how to do this. So if you find out, hey, you're running up here and you're getting lots of no's, lots of denials, there's a way that you can work the back end. Now, you can't you can't change the plans themselves. But what you can do is you can educate the customer, and they can pit one Med Advantage plan against another and even go through certain caseworkers. It will really help how to work directly with customers and Med Advantage plans. There are, even depending upon the state, customers have the right to change Med Advantage plans either once a year, sometimes up to once a month. That's crazy, but that can be done as well too. So it really helps. How well is your relationship directly with the customer? Because you might say, hey, we can't get this wheelchair through community health, but we can get it through this other company. And you can't change the plan themselves, but you can say, hey, if you really want this item, we can keep trying with this insurance, or we're going to recommend that you possibly try this route. So you can do a lot of different ways of just understanding, hey, this is how we're going to get ahead of the situation, isn't it?
Correct.
So anyway, this week, Med Advantage plans, and we just touched on it. There's literally 20 other areas that we can do and talk about how to win with Med Advantage plans. Med Advantage plans now make up well over 50% of the Medicare market in the United States today. That's crazy. It used to be like 15%, 20%. I think it was like 50. It finally hit 51% or more last year. It's going to go well above 75%. So, hey, that's what's coming down the pipe. But hey, next week, this is what's next. So as all the costs keep going up, labor costs have gone up too, especially in the United States. So we're going to teach next week, how do you win with labor? What do you mean, how do you win, Eric? Everything's stacked against us. We're going to lose no matter what. Not so. Just because everything is trending in a negative way does not mean you're going to lose. Last time this happened, it really benefited our business because we figured out how do you win with labor. But hey, that's next week. So what do you do? Listen in next week, and April and I will be here to help you. How do you win with labor? But in the meantime, go to offsiteteammember.com and reach out to us. We'd love to talk with you.